North Adams had a full-service hospital until 1 year ago, when the North Adams Regional Hospital abruptly and illegally closed its doors. The law stated that the community should be given 90 days notice. We were given 3 days. 60 hours, I stand corrected. We stand on public land calling on God and our publicly elected officials and the CEO of Berkshire Health Systems to hear our cry for justice for the citizens of North Berkshire. South Berkshire has BHS's Fairview Hospital in Great Barrington. Central Berkshire has BHS's Berkshire Medical Center in Pittsfield. Justice for the citizens of North Berkshire means that BMC North be made a real full-service hospital. Our elected officials and the CEO of Berkshire Health Systems might think nobody cares. But yes, we do care. If you care, someone cares. And we do care. This is not about the closing of a factory or a business. It's not the loss of our local newspaper. It's not the loss of local ownership of our radio station. It's not that the state closed our employment office in North Berkshire, closed our welfare office in North Berkshire. This is, we draw the line here. When we lose our full-service hospital, you've hit the tipping point where we cannot accept our elected officials' lack of leadership and commitment to ensure a full-service hospital to serve our community. Healthcare is a basic human right according to the United Nations Universal Declaration of Human Rights on Article 25. The United States of America is the only industrialized nation in the world which does not provide universal health care for its citizens. We find ourselves in a system of government-subsidized non-profits and for-profit health care providers. We call upon our new Attorney General to make public what happened and hold those accountable who knowingly violated the law and those who stood silent and let it happen. We call upon her to hold public hearings on her investigation and where it stands. You know, I talked about this before, that they say that the bondholders in Berkshire Health Systems couldn't come to an agreement on a number. But we have to remember who those bondholders were. You know, Wells Fargo, we've heard of them. They were one of the major bondholders in this. And back in 2007, when the banking crisis occurred, Wells Fargo not only got $25 billion in TARP funds just before it bought Wachovia, it got a special tax break from the Treasury Secretary Hank Paulson, which some reports say was worth as much as $25 billion. So these are the people that said that you don't have enough money, that, you know, we're going to call in your note and you lose your hospital. And that's unacceptable to us. And if the government can bail out the big banks because they're too big to fail, we have to let our government officials know that hospitals are too big to fail. We want that hospital open now. So on that note, we call upon our new governor to defend the health care needs of North County residents and to ensure that we receive equal access to local medical care in a full-service hospital. Potholes are a very big problem, but those holes do not compare with the holes left in a community when it loses a full-service hospital.
Right.
We call upon our congressmen to ensure that the citizens of North County have equal federal funding for local health care with a full-service hospital. The same care that the citizens in Central and South Berkshire County have. If the state-funded report states we need federal critical care access status, it's your job to secure the funding.
Exactly.
We call upon our state senator and our state representatives to ensure that North County citizens have equal and adequate state funding of local health care with a full-service hospital that the citizens in central and southern Berkshire County have. North County needs its state senator and state representatives to ensure that our tax dollars, which subsidize Berkshire health systems and provide them with nonprofit status, be tied to binding laws and regulations which require equal and adequate local care to each geographical unit in their service area. And they could also make restrictions on pay, that if you work for a nonprofit, that you can't earn more than 7 times the base salary of any employee of that nonprofit. We call upon each and every mayor, town administrator, city councilor, and selectmen and selectwomen to stand up and call for equal access to local health care and a full-service hospital for the citizens of North County. We are calling on Berkshire Health Systems to open the hospital that they were negotiating to buy a little over a year ago. Berkshire Health Systems' monopoly of health care services in Berkshire County does not permit them to ignore our needs for a full-service hospital. We have no place else to go. Nor does it allow it to exploit North Berkshire County for profit. What's ever sustainable sometimes are the words that we hear, you know. Berkshire Health Systems must meet with us and hear our concerns in a public forum. They boasted when the Leapfrog Award was given to Fairview Hospital, the National Award for a Rural Hospital, they boasted how they listened to the neighborhoods of South County, and that's why they could provide such care. Well, we're asking them to listen to the neighborhoods in North County and provide us with the same award-winning hospital. We will work with Berkshire Health Systems if they'll provide a timeline and a commitment to make BMC North a real hospital with inpatient beds equal to Fairview Hospital in South County. We publicly today make a commitment to call our elected officials on Monday morning, on Monday afternoon, and Monday evening. We are committed to calling, writing, and organizing until our goal is achieved. Thank you very much.
Thank you, Dick.